From the US to Singapore, countries are trying to trace passengers who disembarked a luxury cruise ship last month before a deadly outbreak of Hantavirus was identified on board. Most of the remaining passengers will leave the ship when it reaches Tenerife this weekend. Authorities have identified the Andes strain of the rodent-borne virus, which can spread from human to human, but they say the risk is low.
A once-in-a-lifetime vacation turned into a nightmare. The MV Hondius, which started its journey in Argentina's far south, is now nearing Spain's Canary Islands, where sometime this weekend, Spanish authorities say they will ferry some 140 remaining passengers and crew to shore here in small boats. Port workers afraid of hantavirus are protesting. Many locals are worried.
I don't approve.
The most logical thing would be for them to care about us and not have the ship enter the Canaries.
None of those on board have reported symptoms. Still, they'll all be examined before getting airlifted to at least 23 different home countries. Depending on the country, they'll then be kept in quarantine facilities or required to self-quarantine.
So the risk for the general population is low. Under any normal circumstances, a normal handling of a person should not present any danger to the individual or to the people around. This is not COVID.
The MV Hondius left Ushuaia on April 1st. 10 days later, a Dutch passenger died. His body was taken ashore at St. Helena Island, accompanied by his wife, who later died as well. Around 40 passengers from at least a dozen countries also disembarked. Later, tests confirmed hantavirus as the cause of death. Back on ship, one British passenger was medically evacuated at Ascension Island. A German woman who'd earlier left the ship died in South Africa on May the 2nd. Another ill British passenger was then evacuated at Cape Verde. Both British passengers have tested positive and are said to be recovering. In Singapore, 2 people are being quarantined at this facility as a precaution. Another suspected case is being investigated in Spain. And experts are still trying to pinpoint exactly how the rare hantavirus, normally found in rodent droppings in South America, got onto the ship in the first place, and how it spread.
When does a human being become infected? When people enter areas that naturally belong to rodents, in the countryside, in rural areas.
As with any virus, mutations are possible that could make it more infectious. But authorities stress that even people who had close contact with victims have stayed healthy.
Professor Emily Gurley is an epidemiologist at Johns Hopkins University. Welcome to DW, Professor. Just talk us through the sequence of events that's likely to happen between the ship docking and passengers flying home.
Well, the passengers are going to be evaluated, as you've already described, and they're going to be watched very closely. So there's a lot of attention now on what's happening, and they're getting both the medical attention that they may need and the clinical evaluations, as well as the public health scrutiny, where anyone who is sick is being isolated, and those who've been on the ship are going to be quarantined. And that's to ensure that if they do become sick, they're already isolated from other people so that no more transmission occurs.
And then they get on a plane and go home. And once they get home, is that it? Can they just put all this behind them and forget about it?
Probably not, just because they do need to be monitored for the duration of what we call the incubation period. So if they were exposed on the ship, they should be monitored, for the duration of time where symptoms of infection could occur. And that lasts for a while. So that can be up to 40, 42 days. So these people, their experience with this and the ship is not yet over. They're going to have to wait till they get through that incubation period first, where we can be sure that they weren't infected while they were on the ship.
OK, so in our report, we saw people on Tenerife protesting about this ship's arrival. Let me put something to you and have you respond, OK? So it's all very well scientists, thousands of miles away, telling people on this small island there's nothing to fear and the chances of them catching this deadly disease are low. But this whole episode has been a sequence of unlikely events. Deaths are rare, but they've happened. Human-to-human transmission is rare, but appears to have happened. And scientists still don't know how this outbreak started in the first place. Of course, people are scared of receiving this ship.
So I understand the fear. I would correct one thing, though, in that statement. Death from hantavirus is not rare. It's quite common. I think maybe 30% or so of cases typically do die. So that is what we would expect. And although person-to-person transmission generally is rare, the patterns that we've seen in this outbreak and on the ship are similar to other outbreaks where person-to-person transmission has occurred. We now know that the virus infecting these patients is very similar to the other viruses that public health has experience with. So, of course, I can understand the fear, but these patients aren't going to be, or they're not patients, these people aren't going to be just released into the public. There's a lot of attention here and a lot of effort going into making sure that the people on the ship get the support they need. It's important that they disembark from the ship so that those close contacts on the ship don't continue.
Right.
So this is really doing a lot to help those people, and their contact with the public is going to be very, very low and monitored very closely.
Okay.
I think that they should be proud that they're doing something to help people that are in a very difficult situation on the ship.
Fine. Without wanting to be too... Let's just look at the sort of broader picture. Without wanting to be too sensationalist, we do seem to be living through a period of particularly nasty outbreaks of nasty diseases at the moment. Hantavirus, Ebola, Mpox, SARS, H1N1, swine flu, and of course, COVID. I appreciate there are likely to be lots of different reasons for these, but we do seem to be living through what you might call an epidemiological moment.
Well, yes, we recognize these threats more than ever. And part of that increasing recognition is our increasing ability to find them. So people die every day all around the world without any diagnosis or understanding why. And I think that one part of the reason why we have these emerging outbreaks increasingly recognized is just because our laboratory techniques and our investments in figuring out why people get sick and why they die have gotten better. So we have to contend with this new understanding. I don't want to minimize the threats that these emerging infectious diseases have and the impact of outbreaks. But I think a lot of the change and new recognition is just because we're much better able to see them. I'm not so convinced that they weren't always going on.
Good talking to you, Professor. I'm not sure that I'll sleep much better tonight, but thank you anyway. Professor Emily Gurley from Johns Hopkins University.
Thank you.
Well, just before our show, I talked to Munir. He's a professor in virology and viral zoonosis at the Lancaster University. I started by asking him how worried we should all be about the outbreak of hantavirus.
It is certainly very unusual and isolated outbreak for the first time being reported onto the water within a cruise ship environment. So certainly there is a lot of information that needed to be unfolded because this virus is out there for around 50 years, but not a lot of research has been conducted. In this particular case, there have been some of the questions, though still are outstanding and needed to be investigated. For example, the original source of the infection, where actually the infection has come from, which one is the index case, and how much impact is going to have in next couple of weeks and so on. So therefore, there's a lot of information that is not yet available. However, we do know that this virus is more pathogenic than many other viruses that we have come across. For example, it has around a case fatality rate of 35% compared to corona, which has 0.01%. So overall, the virus is very impactful.
So the time period between when a person is infected and when they start to show symptoms, what is known as the incubation period. We're hearing that can last up to 8 weeks. Could an infected person be infecting others in that time? How does hantavirus spread?
So one of the unique characteristics of the hantavirus compared to other viruses that we are familiar with, it has a very long incubation period that could be up to 8 weeks, which means that if the person is infected now, in next 2 months, they can start showing clinical sign. And that add one of the major complexity, because you can imagine that within the cruise ship environment, people could be allowed to disembark and repatriated to the home and could still start showing clinical signs in next 8 weeks. And that is one of the aspects that has to be considered quite importantly here in this context of the outbreak. And people, for example, could have been infected at very early stages of the of this outbreak that has been around a couple of days now, but still could be hiding and harboring the infection. And within next 8 weeks or so, they can start showing clinical sign. So in this context, the tracking and the tracing and identifying who could actually be infected is going to be quite critical in next couple of months.
And just the point again, so people who could be infected could be infecting others in this incubation period.
So one of the key characteristics here is that the person who is not showing clinical sign is less likely to spread the infection. So the person who has started showing clinical sign initially at the stage, at the early stages of the infections are like a flu-like symptoms, but as it progresses, then it develops into the respiratory or the kidney failure context. So this is different than the coronaviruses. In the coronaviruses, people who are asymptomatic, they can spread the infection. But here in the context of the hantaviruses, people who are showing the clinical sign when the virus is actively replicating within the body and is producing a lot of viruses, that is the stage when the person can infect the other person.
And Professor, who has the highest risk of getting infected?
So hantaviruses are known to infect human of any age and gender and race. So there is no any peculiar predisposition factors when it comes to the human. However, we do know that within the cruise ship environment, majority of the people who've been traveling, they are senior citizen, 50 years and plus, and all unfortunate people who have died, they were also closer to 60 or 60 plus. So we do know, generally speaking, in a public health perspective, is that anybody who is more than 55, 60 and have some vulnerability or other comorbidities and other medical conditions, they are vulnerable to any kind of infection, and hantaviruses are not the exception.
Spanish authorities are now preparing to receive the 140 people or so on board the cruise ship this weekend. They're calling it an unprecedented operation. Could you just give us a sense of, what that operation would entail and what would be the challenges for Spanish authorities?
I think the central dogma in the whole context of the hantavirus in this international outbreak is contact tracing, because that is the most critical aspect, how quickly and effectively we can contain this outbreak. So now you can imagine if people will be disembarked and they will be letting go, I'm sure there are instructions out there that they needed to self-isolate and they have to carry on reporting showing any kind of clinical symptoms, whether they are associated with this virus or not associated with this virus. But the major challenge lies that how effectively those people are managed and monitored. For example, the person who has arrived within the UK from the cruise ship has already been put into the self-isolation for 45 days. And this is a really long time. So longer the time, less likely is the person is going to follow those rules. So effective monitoring of this contact tracing whole procedure is the critical step in defining how quickly we can contain this outbreak.
Will all those who will disembark the ship, will they all have to quarantine?
People even who, so the first stage is that people who are tested positive, they will be put under close monitoring in the hospital setting, where the hospitals are very specialized airborne system where you have literally a very good control onto the air particles and so on. So for them to be treated within the hospital would be the best case scenario. People who will be tested negative, they still have to self-isolate and be under quarantine and monitoring, again, because the long incubation period. So maybe at this stage, they are not showing any clinical sign, and the virus that is harboring within the person is very low to be detected, but that doesn't mean they are cleared from the infection. So until they don't really show any clinical sign for up until the 6 or 7 week, then they have to stay isolated. And 7 to 8 week is only on the assumption that the first week they have already got the infection.
Just to your earlier point, Professor, several countries are now racing to track the hantavirus with the goal of containing the outbreak. From where you sit, are things going according to plan in this regard?
I think if we really look onto the scenario of last week or so in this whole outbreak, I think everything is working according to the nature of the virus, according to the nature of biology, and as we anticipate. By saying that, what I mean is that there are around 150 people. Those were at the cruise ship. And only 3 people have died and only 8 to 9 people have been tested positive. So you can imagine overall the infection rate is relatively low. And that is because the virus is relatively harder to spread from one person to another person compared to other viruses like corona, which was very easy to spread out. So therefore, I must say that at the moment, every regulatory body, every body that is involved in monitoring the infection, including World Health Organization, CDC, and other, for example, MHRA here in the UK, they are trying to contain this infection as quickly as possible. And so far, everything is working out as planned.
All right. Well, thank you to Professor Mohammed Munir, Professor in Virology and Viral Zoonosis at Lancaster University.
Thanks for having me.